Hello and welcome to the Complete Health Podcast, the podcast that brings you a complete view of healthcare, exercise as medicine, and much more.
We're your hosts, Helen and Reece, both physiotherapists at Complete Physio Pilates in London.
This is episode 9, the third part of our chat where we sit down with pelvic health specialist Clare Pacey to talk about exactly the different choices you may have during the birthing process.
Although some of these choices may not be down to you, just like Claire, we believe it's important to understand everything that goes into an assisted delivery and C-section. In this episode with Claire, she details everything you may want to know and also some useful things that you can ask your consultant.
Hello and welcome everyone to the third part of our 4-part chat with pelvic health physio Clare Pacey. Our first 2 editions with Claire, we've been through what is a pelvic health and women's health physio, and then we spoke in edition 2 about pregnancy and all things physio related to pregnancy, and I've certainly had my eyes open to a few things, which is awesome. So now episode 3 with Claire, we're going into birthing and how physio can play a role during birthing and some ideas for what people can do. So with me as always, I have my wonderful co-host Helen O'Leary.
Thanks.
Pleasure, who still hasn't made her way through those pastries actually.
I've got my eye on that.
Waiting for her to go for one.
I'm going to cut it in half again.
And with us as well, we have our wonderful guest Clare Pacey.
Thanks for having me.
Absolute pleasure. So you've been an absolute wealth of knowledge so far, so I'm really looking forward to this because weirdly giving birth is something I know nothing about, very little about. So I'm really interested to see what you've got to say and the information here. So first off, pregnancy, birthing, during labour, all these types of things. What are some tips, tricks, things you can do to help the process?
Yeah, so I think there's just so much information out there now to help women in labour. There's kind of hypnotherapy, courses you can go on, books you can read, which I think, hypnotherapy, hypnobirthing, which sounds a bit woo-woo. I think we almost need to change the name for it because everyone kind of rolls their eyes, but actually it's basically positive affirmations, breath work, and it's brilliant. It's kind of, changing your mindset on birth. So I would, tell people to go and consider that if they've got concerns about birth. I think it depends on the person though. I think you do get some people that are just super chill and relaxed and they don't need to do anything else, and that's fine. But if you are someone that's quite anxious about labour and birth, then I would seek out a hypnotherapy course, hypnobirthing course, or seek the support of a doula.
So explain what a doula is, because we don't really use them in the UK very much.
We're starting to see them more and more. I think they're fantastic, and they basically just act as an advocate, as a support. They're there during your labour, and they will help to support you and calm you throughout. And they're really amazing. They're a wealth of knowledge. They've been at so many births. I mean, as a physio, I'm not at the birth. I've seen a handful of births during my training, but that isn't my area of expertise. So I can advise on positioning, and my general rule to people is if things aren't progressing, try something different, which is generally my motto for a lot of things, and do it differently if it's not working for you. But if you are in one position for a long time and things aren't progressing, then try a different position. And I prefer positions like side lying, where you've come away from the sacrum and the coccyx to allow it to move out the way, rather than lying on your back where you're fixing that area. Try something different. I think if you are anxious, there's so much support out there. So, feel free to email me and I can recommend individual doulas and courses that you can go on. But at the same time, I do think the support you get is during the labour. We're good at that bit on the NHS. It's the postpartum period where people feel a bit like the support is lacking. But during the actual birth, the NHS is incredible. You've got, obstetricians, midwives that are extremely skilled, and you will get support. So if you feel quite relaxed about it, go with it. I think the main things to focus on are breath work and down training the pelvic floor, and remaining as calm as you can, having not had a baby.
Yes, easier. I imagine easier said than done at times.
Yeah.
Definitely. Where does the word doula come from?
I don't know, and I just tried to Google it, and the internet's not good enough. It means something.
We'll get back to you on that.
Well, yeah, we'll find out. But there's some amazing doulas in London. So
I had never heard the word until 10 minutes ago.
yeah,
So
I'm really annoyed my internet's not working.
And this can go, so obviously a lot of people potentially are listening to this going, but that's for private health. And can you take a doula into the NHS?
Yes, no, so they're used to going into the NHS.
Brilliant.
So, and most doulas who work in an area close to you will be used to going into that hospital. And I think the landscape has changed, and I think the NHS is much more welcoming to doulas being there and things than they were in the past. So yeah, they'll know the hospital, they'll know the setup, and they will come into the NHS with you.
Brilliant.
I'd say they're used more actually in the NHS for people than people having private births.
Okay.
interesting.
Yeah.
Okay.
So a lot of people do have natural births. And there's some things that can kind of happen when you have a natural birth. So we hear about tears quite a lot.
Yeah.
So what are the stats around tears and how good, bad and ugly can they be?
Yeah, so tearing in birth in a vaginal delivery is very common. And so 85 to 90%, depending on the research you read, will tear during delivery. And these tears are quite wide-ranging. So you have a grade 1 tear, which is just skin. Mm-hmm. So you're winning.
Just skin.
Skin, just a grade.
I'm squirming here in my seat, to be honest.
Yeah,
I know.
I don't want to scaremonger with any of this. But I think it's important to be informed and to know what may or may not happen and know what to do afterwards. But yeah, a first degree is tearing through the skin layer. So often they don't repair those and they're like a graze and it just heals quite quickly. The most common would be a second degree tear, which means the tear has gone into the pelvic floor muscles. So again, this is why doing the Kegel exercises, the pelvic floor exercises postpartum is so important, because these muscles are often torn. And then you have, and they're the most common, third and fourth degree tears only happen in about 5 to 6% of births. So this is something that I just wouldn't worry yourself with, but know that if this happens, you will definitely want rehab following. And it's these clients that will be offered care on the NHS without question. So third and fourth degree tears is where you tear into the back passage. So you have a 3A, B or C tear. So a 3A tear is where you've torn less than 50% into the external anal sphincter. 3B means you've torn more than 50% into the external anal sphincter. And a 3C is where you've torn through the external and internal anal sphincter. And a fourth degree is the whole way. So it's through the sphincters and the mucosa. So if you have a third or a fourth degree tear, you will know about it. You will be taken to theatre and a consultant will repair your tear for you, which is really important under bright lighting, so that they do a really good repair, and you will receive follow-up. So if you have this tear and you haven't received follow-up, you need to chase your NHS team for that, or obviously seek private care if you're in a private hospital. So yeah, I wouldn't kind of over stress with those because they are
it's such
rare.
small percentage.
And you worry about that at the time. But for most people, having some tearing of the muscles, the births I watched, you don't feel the tear at the time it happens. People really feel quite fearful of the tears, but you don't feel it. Don't feel the episiotomies, which is where they make a small cut into the pelvic floor. So they make a cut at a 45-degree angle. So they generally will only do an episiotomy, a cut into the pelvic floor, if you're having an assisted delivery with a ventouse or a forceps. Otherwise, it isn't actually indicated to do so. But yes, generally with tears, the perineum's amazing. It's like the inside of the mouth. It heals really well. And the stitches they use for first and second degree tears will dissolve in 7 to 10 days, Healing will take about 4 to 6 weeks, probably only 2 weeks for a graze, but for second degree tears, 4 to 6 weeks. And that'll be the end of it. Again, you can sometimes get complications with infections and tissue breakdown and things like that. But you have midwives coming to you after your birth, and they will be checking on that. And if the pain is getting worse, then you just want to get those stitches checked.
So make sure if you've got stitches that you get someone to have a look at it.
Yeah.
Even if you think it's okay, just to kind of
Yeah.
flag up anything that might be
Yeah,
developing.
and the community midwives will check that, and then they will discharge you when they feel things are fine. But if they've discharged you and suddenly you feel the pain's getting worse, it might be there's an infection, and so you want to just jump on that, see your GP. Third or fourth degree tears, the stitches take a lot longer to dissolve because they use different sutures, but again, we're not going to focus on that so much because that is less common.
Now, specifically talking about tears, Claire, is there anything in particular that can be done to care for the stitches afterwards, and any advice in that realm?
Yes, absolutely. So it's keeping it quite simple, really. Splashing the area with some warm water a couple of times a day to keep it clean. And then you want to keep it as dry as possible because, well, bacteria loves warm, moist environments. So you want to keep it dry. So patting it dry with a towel, air drying the area. It's difficult because of the bleeding. We call it lochia, the bleeding you have after birth. And this can make it difficult to keep it dry. So I tend to say to people, every time you go to the loo to pass urine, just change the pad to help with keeping the area dry. And I wouldn't sit and soak in a bath initially for long periods. If you had a cut on your arm, you're not going to soak it in water for a long period of time. You want to let the tissues heal. So clean, dry, and if it's really uncomfortable, it varies so much. Some people can sit and have no issues, and others are really uncomfortable sitting down for a couple of weeks. So if the area is quite swollen, you can kind of keep off the area, so feeding the baby lying on your side, leaning back, kind of varying your position. Being sat directly down is going to encourage swelling to the perineum. And if it's particularly swollen, you could also try some ice. So I tend to get people to find a maternity pad or a sanitary pad, soak it in water, and then put it in the freezer.
Nice. And
then you can take that out and wrap it in some kitchen roll or something, and then you could just place it on the perineum for short periods, 10, 20 minutes, that sort of thing, to help with swelling. But also gentle pelvic floor exercises, which you can start straight away post-birth, as soon as your catheter's removed, if you have one, will just help get circulation to that area.
Even with tears in the...
Absolutely.
Okay.
At the same time, if you are focusing on other things and breastfeeding's a challenge, it's not the end of the world if you don't start your pelvic floor exercises straight away, but it's never too late. But the sooner you get going, the sooner things will start to strengthen up, and it can help with getting circulation to the area and help with healing and getting rid of swelling and things like that, if you start them straight away.
So just a quick question, Claire, about tears. We've spoken in a previous episode about doing pelvic floor exercises during birth. Is there any evidence, or from you anecdotally, that pelvic floor exercises during pregnancy are good at preventing tears during birth?
No, not preventing tears, but there is evidence that having a strong pelvic floor will help your delivery.
Right.
But not to prevent tears. There is some evidence for perineal massage to help prevent tears, and the research basically shows that if, say, 10 women do it, 1 woman will benefit. So if it really freaks you out, the idea
perineal massage.
of doing perineal massage, and you just think it's not for me, don't stress about it. But for me, as a women's health physio, pelvic health physio, I would do it.
So what kind of thing would you do? What would you use?
So I'd use a lubricant, and I'm very specific about the lubricant that I use. So I recommend a company. I should try and get commission or something from them. I recommend it so much, but it's a company called Yes Organics, and I recently did a bit of a literature review on the lubricants available in the UK, and actually it's the only one really that's the right pH balance for the vagina and the right kind of osmolarity, so it's not an irritant and it's the right pH balance, and it is important the vagina stays within its correct pH balance, so you don't get things like thrush and bacterial vaginosis and things like that, which
the likes of KY, Durex, they don't meet those criteria. So
we'll put the link to that literature review maybe
we can do.
Show notes,
yeah.
Or, that'll be good if people want to access it.
So perineal massage, I'd use something like that. I think you probably, if you really wanted to do it, it might be worth coming for a session and someone can talk you through exactly what to do. It's probably easier than doing it over this. But there is some devices now. There's the Epino and the Ante-natal, which you may have heard of. And these are devices that people use for perineal massage, basically as an alternative. So it's a small sort of balloon pump. So you insert it. It's very simple. You insert it into the vagina. And then you've got a little pump that you squeeze and it increases the balloon within the perineum, and you get used to that within the vagina. So you get used to that stretch feeling. And it's a bit like training for a marathon. You know, you don't ever run the full 26 miles. So you don't need to get the balloon all the way up to the head side of a baby, but you just get used to that feeling of a stretch. And so when that happens, the idea is that you're not worried, you're not scared of that feeling. You know, that's a good feeling. That means the baby's coming. You breathe through it. You remain calm. So, yeah, I think they're pretty good, actually, the Epino or the Ante-natal, or just doing perineal massage that you can do yourself, or your partner can do it for you if they're up for it. But, yeah, there is some evidence for that.
And we can put those 2 links as well into the notes.
Yeah, absolutely.
Yeah.
So you mentioned before about ventouse and forceps and delivery and kind of assisted delivery.
Yeah.
So do you want to go into a little bit more detail about that?
Yeah. So if the delivery is not progressing, the obstetrician or the midwife, obstetricians will be used for assisted deliveries actually, but they may decide to use a ventouse, which is a little suction cap that they put on the head of the baby to help pull the baby out, or a forceps delivery. And for these deliveries, they tend to do a small cut at a 45-degree angle, which is called an episiotomy. And the idea is to prevent a 3rd or 4th degree tear. I think with forceps deliveries, it's an interesting one, and there is a place for everything. And obstetricians are would probably think differently, but I can only talk from my experience as someone that deals with the postpartum issues that people have. But I think forceps deliveries, forceps are used too often in the UK in comparison to other countries. So, for example, in Scandinavia, they have banned forceps for a decade now, and they managed to not use them. So because of that, because they know they haven't got a forceps option, I think they sometimes make a decision to do an emergency cesarean sooner than maybe we would in the UK. And I think sometimes because in NCT, the feedback I get is that women are made to feel quite fearful of cesareans. And there is a place for everything. And I think because women are made to feel that cesarean is a bad option, they'll often kind of push against cesarean during their labour at all costs. And then that might end up resulting in a forceps delivery. And I personally am not a massive fan of them, just because of the risk of pelvic floor avulsion, and this is where the pelvic floor muscles come away from the side wall. So this happens in about 34% of forceps deliveries, and I don't want to, it's not scaremongering, but I think if you're going to educate women on the risks of cesarean, which you absolutely should do, because of course there are risks, it's major surgery, I think it's also important to educate women on the risks of forceps delivery as well, and that way they can then make an informed decision between the two and what works for them. And you know, there are times when it's an emergency and the baby needs to be got out, and a forceps is a very effective way of doing that. And I have treated many women who have had forceps deliveries and are totally fine. And it's the way they're used, and there is no one way of using forceps. and all the rest of it. But I think it's important to be aware of the risks of both. And if you have had an avulsion to the pelvic floor, it will only be part of the pelvic floor, so you can still have rehab because we can strengthen the rest of the muscle. But that part that has come away, there is no surgery to treat that currently. Hopefully there will be in the future, but at the moment it doesn't exist. And as a physio, you can't strengthen a muscle that's not attached. Yeah. So you do have limits to your rehab. And so, yes, it's not being scaremongering, it's just being clear on risks, benefits, your situation. Yeah. Because just
informed consent,
yeah,
really
informed. And if
decisions.
Things aren't progressing and the doctors are saying, what do you think? Because they will ask you, are you happy? Do you want to keep on going? Or what are you thinking? And if you're made to fear a cesarean, you're going to be wanting to keep going at all costs. Yeah. Whereas if they're saying to you, okay, it looks like we're probably going to need forceps, it's going that way, what do you think? You might choose that you want to do a cesarean, but it's multifactorial and it depends on so many different things. And, if you're someone that's already having pelvic floor problems in your pregnancy, or you've had one delivery before and you're already having issues, you might think, actually, for me, do I want to go through that? Or you might be someone that has amazing pelvic floor, everything's been good, and it's less of a risk. It's just weighing it all up, and there is no one way.
I think there are probably conversations to be had before.
Yes.
Because it's going to be an emotional time.
Absolutely.
While you're giving birth, isn't it? And to make sure you have that information and have had those discussions so you can make those decisions in the moment. Exactly.
So you've got an idea of where you want to go and what would be good for you. Yes, and going from there.
So we touched on C-sections. Obviously, the surgery towards a C-section has changed dramatically in the last decade or so. So do you want to go into that in a bit more detail and kind of tell us what happens? And
yeah, they used to do a vertical incision all the way down, and it's advanced so much now. So it's very, very low, usually kind of really low in pubic hair, so you can't really see it. And it's a fairly small cut, just a bit larger than the size of the baby's head. Mm-hmm. And essentially they just cut through the skin and underlying fat and into the abdomen, and then they will usually move the bladder out the way and make a cut into the uterus. It's very quick. I've watched a few, and it's the repair after that takes the time. The baby is out in a flash because they're so experienced, and then the baby is put onto you, which is lovely. So you get the skin to skin, and you can start feeding and everything whilst they then do the repair. So we try to call it now an abdominal birth rather than a cesarean. Yes. And if you find out that you have to have a cesarean for whatever reason, there are times when people need to have them. For example, if you've got placenta previa, where the placenta is sitting very low, so the risk is that the placenta will come out first, which is obviously dangerous. And so you'd have a cesarean, or if the baby's breech, you may have a cesarean. So in those cases, you can still have a very, kind of relaxed and calm birth, and you can apply the hypnobirthing you've done to that, because it's still, if you've never been into hospital and had anything done, it's not an easy option having a cesarean. Yeah. And so using your breath techniques and the positive affirmations and all of that, you can still use for your abdominal birth. But yeah, they're the roots.
Question without notice. Cesarean, where does that word come from?
Oh gosh, it's like doula. I looked up doula. I need to look up that. Doula is the Greek word, means woman's servant, which is, but really they're just a support. But cesarean.
I think I like the word advocate better.
Advocate, yeah, exactly. No, that's another one.
One we can look at between.
Check the notes.
Thank God for Google. Yeah.
We'll catch that up. Mm-hmm. Care after birth from a vaginal birth compared to an abdominal birth? How do they change? What are the outcomes generally?
Yeah, it depends. It's completely different.
Yep.
Obviously, if you've had a abdominal birth, you'll have weakening of your pelvic floor because you've carried a baby through your pregnancy.
That's a really important note.
Yeah, you're not completely exempt from doing any rehab
Yep.
Of your pelvic floor. It's still important. But you haven't had a baby travelling through the the birth canal, you haven't pushed and bared down onto your pelvic floor during the pushing stage of birth, and you haven't had tears or cuts to the pelvic floor. So usually from that perspective, it's quicker to get back to the high impact exercise and things like that. But not always. Again, it really depends. You could be someone that has a very, relative, I don't think any birth's easy, but a relatively simple vaginal birth where you haven't had much tearing, everything, you weren't pushing for very long, everything was it's just luck of the draw, everything was in the right position, the baby wasn't too big, and it's all fine, and you can get back to things as quickly as someone that had a cesarean from that perspective. But if you've had a vaginal birth, and 50% of women who have had a vaginal birth will have a prolapse, and we can't...
50%?
Yeah.
Wow.
Only 20 to 30% will be aware that they have one on the whole, but the stats are quite high, and so we need to rehab that. And if we need to really strengthen the pelvic floor muscles, and you might need to do a bit more of that. So it really depends. Cesarean abdominal birth can be a bit more uncomfortable initially because you've got an abdominal incision. So getting out of bed and moving around in the first few days can be more uncomfortable. But again, if you've had a forceps delivery and episiotomy, that can equally be uncomfortable. So there is no one size fits all ever, but especially in this situation. And so much is genetics and, your tissue type and size of baby, and how big the baby's head was, and how long you're pushing for. I mean, there's so many factors. Yep. So we have to meet you where you are, basically, and then go from there.
So important to see someone like yourself who can put all that together. Ask the right questions and get the right information, and put a person-centered plan together for the rehab.
Exactly. Yeah.
Great.
Anything else?
No, I think that's
wrap
fantastic.
it up.
Yeah. Are you just another question without notice here, Claire? Do you see a difference in age of women at what stage in life they're giving birth, and and difference in their rehab following, like young 16, 17, 18-year-old compared to women in their mid-30s? Like, is there a difference generally in outcomes?
I mean, I think there probably is. I think there isn't anything in the literature. Okay. In London, where I practice, mostly I see women who are in their 30s. Yep. I don't tend to see people seem to be older, I think, in London having babies, and that is what I happen to see. But of course it's a factor. I hope in a few years there'll be almost an app that you can input all your information, your age and your risk, and it will tell you, the type of birth that would be best for you, or just a bit more of a protocol around it. But of course, as we age, our tissues change and the elastin changes, and we know that of course it's going to affect things, but there isn't any kind of research that says and I don't think anyone's going to choose to have a baby much younger for that necessarily anyway. But it's an interesting point.
There's been an overall shift in that age of new mums, hasn't there, to later on, and that's to do with many different factors. But I guess bringing it back to more of a athletic and S&C kind of side, the older you get, the harder it is to rehab from injuries. So it would kind of make sense.
Yeah. But, I saw a lady yesterday actually, and she had twins, and her babies are on the neonatal unit, and she said she was on there and with her babies, and this kind of 19-year-old girl walked in a crop top having just had a baby, and she was just like, oh my gosh, like flat washboard abs, and she was like, this is so unfair. So I think, of course it's harder, but you just have to work a bit harder at it, and it's not that you can't get the strength back and get to where you need to be, but we just have to give a bit more attention to it, probably. I
think that's probably a really good point, isn't it? That doesn't matter when it happens, that you can still rehab.
There's always lots you can do. Exactly.
Perfect. All right, I think that's
brilliant. Thank you so much.
Some good information there, and opened my eyes to some things and made me wriggle around in my seat for a little bit. But really excellent. So that wraps up edition 3 with Claire, which is episode 9 for us. Yeah. We're getting through them and learning some really fantastic stuff. The next edition will be with Claire will be the postnatal edition, so getting into what happens after birth and the rehab things which we've touched on a few times during our first 3 episodes, but getting a little bit more into the nitty gritty of that. Now, Claire, just quickly, if anyone needs to contact you, wants to book, any other information, what's the best way to get in contact?
Yeah, probably by email. So I'm on claire@rephysio.com. And my social media account is re.physio, so re.physio.
And that's on Instagram.
Instagram, yeah.
Perfecto. All right, we'll see you again soon for edition 4 with Clare Pacey.
That concludes episode 9 of the Complete Health Podcast. For any more information or questions, please feel free to email into us at either reece@complete-physio.co.uk or helen@complete-pilates.co.uk. We're also on Instagram as Complete Health Podcast, or one word.
If you haven't already, please go back and have a look at our previous episodes with Claire, where we discuss what exactly pelvic health physiotherapy is and common pregnancy-related musculoskeletal conditions. Keep an eye out in coming weeks for our next chat with Claire, which covers all things to do with the postnatal period and how you can safely get back into exercise. For another week, stay healthy and goodbye.